Hi, I'm Dr. David Goldman, refractive editor for Ophthalmologyweb.com, speaking today with Dr. Marguerite McDonald. Dr. McDonald is a cornea, cataract, refractive, and anterior segment specialist with Ophthalmic Consultants of Long Island. Thank you so much for joining us today.
My pleasure, David.
I wanted to talk today a little bit about TearLab. What first got you interested in TearLab?
Well, any reliable diagnostic technology that can help doctors diagnose and follow the treatment of dry eye is important to me.
And how has it changed your practice in terms of management of dry eye patients?
Well, occasionally I'll tell someone you have dry eyes, and because of the disconnect between signs and symptoms, sometimes they say, no, I don't. I don't have dry eyes. I don't have that many problems with my eyes. And if you can say, well, when I examine you, you have tremendous findings of advanced dry eye, and as a matter of fact, here's your number, and it proves that you have dry eye. The patients like the number. It confirms that the doctor knows what they're talking about, and it encourages them to stay on treatment.
And what are some of your success stories in using it with patients?
Well, first, it's interesting that the patients, while they're waiting for me, will read everything that's in the room, and they'll read the TearLab brochure. And I have walked in the door and had people hold it up and say, will you do this test on me? So, there's no pushback on doing the test, especially because there's no out-of-pocket expense for them. And they want to know that the treatment is working, and it encourages them to stay on the treatment. The discussion is faster, and they have faith in you. And also, it differentiates the practice. This is something new, it's cutting edge, it's non-invasive, and you have it, and you're the first one to have it in the area.
And do you find it's easy to use?
Extremely easy to use. You can teach a technician to use it in less than 5 minutes.
And using the machine, I know you require some type of certification as a laboratory director. Was it difficult to obtain that certification?
No, it's not difficult to obtain that certification at all. TearLab has contracted out this process to a company called COLA, and they take care of most of the paperwork, and they get it done very efficiently.
And do you find other advantages as well to having the certification as a laboratory director?
Yes. Once again, it's another differentiating factor, and the patients see we have notification that we're certified that's visible to the patients in the waiting room and on some of our materials, and that reassures them that this is a high-quality practice with a certified lab.
And would you recommend this for other practitioners of ophthalmology?
Absolutely. It's good medicine and good business to participate in TearLab testing.
Excellent. Well, I know we're always looking for better options, especially for the dry eye patients, and as our patient population is getting older and there are more and more of them, we're going to have to come up with better options to treat them.
Absolutely, David.
Well, thank you so much for speaking with us today.
My pleasure.
For more information, please click on the links below.